Welcome back to our channel. In today's video, we will explore dehydration, its causes, signs and symptoms, diagnosis and treatment. Dehydration occurs when more water and fluids leave the body than enter it. Even low levels of dehydration can cause headaches, lethargy, and constipation. The human body is roughly 75% water, and without this water, it cannot survive. Water is found inside cells, within blood vessels, and between cells. Sometimes dehydration occurs for simple reasons. You don't drink enough because you're sick or busy, or you lack access to safe drinking water when traveling, hiking, or camping. Other causes of dehydration include diarrhea or vomiting. Severe acute diarrhea, which comes on suddenly and violently, can cause a tremendous loss of water and electrolytes in a short amount of time. If you have vomiting along with diarrhea, you lose even more fluids and minerals. Fever. In general, the higher your fever, the more dehydrated you may become. The problem worsens if you have a fever in addition to diarrhea and vomiting. Excessive sweating. You lose water when you sweat. If you do vigorous activity and don't replace fluids as you go along, you can become dehydrated. Hot, humid weather increases the amount you sweat and the amount of fluid you lose. Increased urination. This may be due to undiagnosed or uncontrolled diabetes. Certain medications such as diuretics and some blood pressure medications can also lead to dehydration by causing you to urinate more. The body's initial responses to dehydration are thirst to increase water intake and decreased urine output to conserve water loss. The urine will become concentrated and more yellow in color. As the level of water loss increases, more symptoms can become apparent. These include dry mouth, eyes stop making tears, sweating may stop, muscle cramps, nausea and vomiting, heart palpitations, lightheadedness especially when standing, weakness, decreased urine output. As dehydration progresses, the body tries to maintain cardiac output by increasing the heart rate and constricting blood vessels to maintain blood pressure and blood flow to vital organs. The skin may feel cool and clammy as blood flow is shunted away from the skin to internal organs like the brain, heart, lungs, kidneys, and intestines. With severe dehydration, confusion and weakness will occur as the brain and other body organs receive less blood flow. Finally, coma, organ failure, and death can occur if dehydration remains untreated. Your doctor can often diagnose dehydration based on physical signs and symptoms. If you're dehydrated, you are likely to have low blood pressure, especially when moving from lying to standing, a faster than normal heart rate, and reduced blood flow to your extremities. To help confirm the diagnosis and pinpoint the degree of dehydration, you may have other tests such as blood tests. Blood samples may be used to check for factors such as the levels of your electrolytes, especially sodium and potassium, and how well your kidneys are working. Urinalysis. Tests done on your urine can help show whether you're dehydrated and to what degree. They can also check for signs of a bladder infection. The only effective treatment for dehydration is to replace lost fluids and electrolytes. The best approach to treatment depends on age, the severity of dehydration, and its cause. For infants and children, using over-the-counter oral rehydration solutions is recommended. These solutions contain water and salts in specific proportions to replenish both fluids and electrolytes. For children and adults with severe dehydration, they should be treated by emergency personnel or in a hospital emergency room. Salts and fluids delivered through a vein intravenously are absorbed quickly and speed recovery. Thank you for watching our video on dehydration. If you found this information helpful, please like and share the video. Also, don't forget to subscribe to our channel to stay updated on our latest videos.